This is Dr. Jeff Brown with the Merge Medical Podcast. I'm joined by my co-host, Dr. Jeff Cole and Phil Sayles of Summate Technologies. Summate Technologies uses revolutionary point-of-care scanning technology to automate inventory and payment management, thereby increasing efficiency, decreasing costs, and improving patient care. Thanks for joining us, Phil. Phil, tell us about the product.
So Summate Technologies has developed a complete solution which affords point-of-care scanning not only at the edge of the sterile field for packaged products, but affords scanning of plate and screw usage from inside the sterile field, which is the true point of care and where they're used. I found a technology out of New Jersey that is microchip based, and it's sort of half of an RFID chip. And one of the properties of the chip is it's extremely robust, and another property is it's very, very small. It's about the size of a piece of glitter. And it's light powered. It doesn't read optically. The idea behind our technology is to take this microchip, which can survive reprocessing, and steal an idea that's used in retail. So everyone's gone to the grocery store and seen the shelves of products with the little tag on the edge of the shelf. That tag corresponds with the item or product that's over it on the shelf in a row. Well, we basically take the chip and with our software are able to map orthopedic trays. We call the process set mapping. And what effectively it does is create orthopedic digital sets and trays, which bring enormous benefits with regard to inventory management and control for the device company, as well as quality, patient record accuracy to the hospitals and providers.
And how about the need? I mean, I think it seems pretty obvious that the way we do things in the OR as far as documentation is very old school. But what can you add to that?
Well, the OR documentation process, due to the nature of the EHR and its the protective rules surrounding it, has not lent itself to point of care scanning. So manual keying of usage information, not only the product number, but serial number, lot number, expiration date, is a challenge for operating rooms, which can be addressed by scanning where the products are actually used and capturing all the data in one step.
And do you have any competitors?
We don't have any direct competitors per se. You could say that any company that tries to introduce a laser barcode scanner to the operative environment could be seen as a competitor, but they have such low success rates for scanning that there's been no adoption.
What can you say about the technology that you're using? What makes this thing really work? What's transformational as was previous technology for Walmart and other point of care companies, exclusive licenses? What can you add to that?
Sure. So we were able to actually back into some of the benefits. So when you scan inside the sterile field, and what we're doing is we're scanning the trays. We're not scanning the actual implants. We're using a process called set mapping, which we have extensive IP on, which involves scanning a location in the tray next to the implant, which correlates to our software, which delivers the full information, not only the implant that was used, but which tray it came from. The user needs to have a visual feedback of the scan. So we built what we call the Trakker, which is a small footprint touch screen that delivers the feedback on the scan so the technician can see what they're scanning. It also re-engineers the workflow in the OR so that we can scan packages before they're used to increase patient safety, because we check them against the FDA recall, and we also check them for expiration date. So that Trakker brings digital technology to the edge of the sterile field that not only benefits the actual operations of the facility, but it improves patient safety.
And what stage of development are you in currently?
So we've developed a full system. The software is done. We've developed the marking technology, which are called tag marks. And we have done one official rollout at an account at University of Vermont, where we scanned 8 Synthes trays with 100% accuracy success. We're currently in our angel round. We've raised $1.5 million to date. We're looking for another 750. 750 gets us to customers. And moving forward, we're looking to do a Series A round of $3 to $4 million past that.
What's the low hanging fruit as far as customers? It seems like hospitals might be the long sell.
Excellent point. We've basically targeted surgeon-owned ambulatory surgery centers as the initial deployment market. And the method we're using is we're working through their preferred vendor. Typically, they have a prime vendor for their implant trays. So we're working with currently right now with One Surgical. We have a couple of other customers we're talking to. So the path to market for us will be the ambulatory surgery center market first, ones that are surgeon owned, and working through their preferred device vendors to bring digital trays to those accounts. Secondarily, we're working on a grant with NIH and FDA, a $1 million grant to develop a playbook at Duke, Geisinger, and University of Nebraska that other hospitals can look at to deploy this technology.
I assume it's non-dilutive.
The grant is non-dilutive, and the angel round, we do have a $300 debt note over the company, which was subscribed, but the angel round has 500 left. We've had 250 taken so far, and that is equity. So it's buying equity. There aren't any convertible notes or warrants. It's an equity play.
What do you think the potential is for, the company, dollar-wise, I'm saying?
Sure. In the U.S. point of care scanning market and the hospital market is between $1 to $1.5 billion. That's just for the scanning. The ambulatory surgery center market, ortho ambulatory surgery center market, we see as a $100 million market. Of course, the problems that exist in the United States exist over in Europe. All first world countries have this problem. The unknown for us and the real potential bonanza is the value of the data we generate, the macro data. There's an incredible amount of unmonetized data in the healthcare industry, especially with orthopedics, that is left on the table and unmonetized. We think that the data we generate will be worth significantly more than the markets I just stated.
And who will own that data? Will your company? Will it be shared ownership with the surgery centers, or? It
will be some form of sharing, with us being very small. The big fight will be between the surgeons and the actual employers at the hospital as to who owns that data and who gets the monetary reward. That's TBD. We're not sure about that.
That's a recurrent theme. Data is the new gold. It's clear.
This is a bonanza market that's just waiting to be developed.
It's fascinating.
Yeah, this has been very informative. My mind is kind of turning as far as who to try to introduce this to, and
I appreciate the opportunity, guys. This has been fun. I've enjoyed it.
Yeah, well, we've enjoyed having you. This is the part of the interview where I like to ask the people we're interviewing if we've missed anything, if there's anything else you'd like to discuss or say. This is your opportunity. And we've certainly enjoyed having you. This has been eye-opening for me.
Okay. Would you like me to just, I thought of something.
Sure. This is it.
So when you're raising money with a company and you're talking to customers, there tends to be a strong emphasis, understandably, on dollars and money. The other piece of Summate that I think is interesting is the philanthropic piece of it, which is that the data and data automation capture in the operating room will eventually be used to advance medicine. The holy grail for medicine is to connect outcomes with process and products. And right now it's stifled because the front-end data collection is manual, error-prone, and siloed. With the success of Summate and the Summate technology, it doesn't necessarily even have to be us. We think that the capture of this data will unlock unparalleled value in medicine for connecting outcomes with process and procedure.
That's fantastic.
Yeah.
That's really good. I think we wrap it up there. This has been great. Phil with Summate Technologies, thanks for joining us.
Thank you very much, gentlemen. I very much appreciate it.
You're welcome.